when the United States has participated in international food programs, it was centered around if we will feed you, but then you have to use everything from us uh, in even above and beyond your own farming communities. And so where countries could have been sustaining food wise, they became dependent on Western nations, even down to using GMO crops. And with the crops being patented, where, for the cultures, they're used to saving the seeds, they were told, no, you can't save the seeds. You have to buy new seeds every growing season. Um, so you can see, where you said earlier about how um, it has been used, food has been used as a weapon. That's how it's been used as an example of how it's been used as a weapon.
Yes, that was a perfect example, and
Hmm.
those are some of the things that she was citing. But I was extremely happy that that's how they went with that Nobel Peace Prize this year. I
Yes.
thought that was awesome.
And hopefully it will spur um, nations to revitalize their sustainability through food.
Yes, absolutely. I'm really hopeful that it will. And it also draws attention to what's going on in our country as it relates to the pandemic and the long food lines that we have, for some
Yeah.
people now.
Okay, so it's 5 o'clock and we will get underway. Good day, and thank you for joining. I am Sherilyn Francis, and on behalf of the Morehouse School of Medicine Prevention Research Center, we welcome you to part 12 of the FAM Strong 20 virtual series. Additionally, we invite you to connect with the MSM PRC via your favorite social media platform using hashtag FamStrong20. The mission of the Morehouse School of Medicine, PRC, is to advance scientific knowledge in the field of prevention in African American and other minority communities, and to disseminate new information and strategies of prevention. The MSM PRC strongly holds to the applied definition of community based research, which is dynamic, community and research entity, partnership focused, also focused on prevention, is tailor made, is ethnically and culturally focused, and emphasizes health policy to advance health equity. I now present to you part 12 entitled Our Community Healthy Neighborhoods, presented by Dr. Christopher Irvin and Miss Mary Wilson. And now, Dr. Chris.
Good afternoon, good evening, everyone. I thank you for inviting me to today's Fam Strong session. And just quickly, because I want us to be able to have a very dynamic and interactive session. And so I'll just, first, say hello for you, for me and Ms. Wilson, and then quickly um, start our evening. And the way I want to start is to do it more as a story or a way to lay the groundwork for what I and Ms. Wilson are going to be talking about in the concept of having a healthy community and healthy neighborhood. And when we talk about this, we want to think of a healthy neighborhood, not just physical health, but physical health, mental health, emotional health, financial health, and environmental health, and how they all intersect. And so I will just, start this way. That's the best way to start, just to jump into it so we have more time to interact. And I will admit that one, I am an Atlanta native. I was born and raised in Atlanta and have lived in South Fulton pretty much um, for all the years I've been here. Outside of when I went to med school and everything else, the vast majority of my life has been in the various South Fulton neighborhoods. And that include the Venetian Hills community, the Ben Hill community, and now I reside in the Red Oak College Park community. And so I present this tale with that framework. And if we are familiar with South Fulton, then you may know where the Roosevelt Highway, Buffington Road area is, and that's where I live. And so this is where I'm going to frame the story of imagining, someone, young person, not even a young person, an adult, working at a decent job, making somewhere between $15 and $20 an hour, but they have a job where they have to clock in and out, and they must commute along the Roosevelt Highway corridor. And one of the things that should be noted about the corridor, there are lots and lots of distribution centers, and even a quarry. So you have a lot of heavy equipment, 18 wheelers, diesel trucks. There's even train tracks that constantly run through that area. So we're already having an environmental health issue. And say if that person has asthma, and it's fumes from trucks, from trains, from industrial waste that can really exacerbate asthma, and they get ill. This starts leading to what challenges our communities, because when that person gets ill, first they're going to miss time at work. And not only are they going to miss time at work, there's a chance that they will have to go seek care. And if they're lucky enough to have insurance, that still requires a copay. If they are unfortunate to have insurance, then their best bet is maybe an urgent care center. Either way, they now are having to come out of pocket, um, for their care, and they miss time at work. This could easily lead to them having to make choices about, um, their finances, and say this is about the time that they, were supposed to get their emissions checked or get their registration tags done, and they had to use that amount again for their health care. And they were hoping not to get pulled over. And I'm really not exaggerating, because that actually happened to me, not too long ago. I was having trouble with my emission, and even though I had the funds to get my emission done, I couldn't get my tag. And the day I got my truck repaired to get my emission, I got pulled over. So these are not, very fictional scenarios. Fortunately, I had a very good outcome, and I didn't get into any situation, but not all of us would be that fortunate, and this could lead to the person now losing their car, um, and or ending up with fines that then can get them into more into legal constraints that can cause a loss of job. Um, and then if they have family members, what does this do to the household? Who do the kids live with? Must they live with their grandparents? Were these grandparents expecting to have to care for their children or their grandchildren? Um, and even if the person wants to get health care, where I live, we do have a shopping plaza, but there's no pharmacy. Now, say if having lost my car, and I needed my prescription filled, am I going to get my prescription filled? How am I going to get my prescription filled? Um, Even am I healthy enough to walk? And I live in a community that I've been there for 15 years. I think we've only had sidewalks for 5 to 6 years. And when you start putting all this together, you start imagining, what does a true healthy community look like? Do we have places where we know our health is going to be okay? If we do have health challenges, do we feel comfortable we're going to have the right food to eat, that we'll be able to get our prescriptions filled? Um, for many of the chronic illnesses, physical activity is key to staying healthy. Do we have places to walk, to ride bikes, to exercise, to enjoy outdoor activities safely, without having to worry about cars and trucks and planes flying overhead? And also, is it a community where our children, our teens, our adults, and our seniors can all live together, happily and safely? And so that's the picture that I would like to I've created for you as we get into the questions and answers. And I'm going to turn it over to Mary, Ms. Wilson, on how do we address those issues? How do we use our voice to start addressing those issues? Mary?
Thank you, Dr. Chris, and hello, everyone, or good afternoon, depending on where you're watching from. This is really something that Dr. Chris and I have worked together on for many years in South Fulton. Most recently, I have been involved with developing a new initiative that's called Ubuntu Community Catalyst. And what that really involves is developing residents of the community that is south of I-20. Most people really believe that all of the resources that are available to individuals that may live in the city of Atlanta or maybe DeKalb County even. Sometimes they think those kinds of resources are trickling down to the South Fulton community, but they are not. And the scenario that Dr. Chris just described is really, it's what's happening to the families that we are working with in the community. And as he was describing what is a livable community, well, that is one of the things that we've been talking about in the South Fulton region now over the past 3 years. What does a livable community look like? Can we reimagine what we need as a community so that we can have a better quality of life? So, some of the things that the community says that we need to improve on as it relates to resources and the type of service providers that we need in the community are in the areas of behavior mental health, environmental health, economic and workforce development, and also housing affordability. Those are the conversations that we've started to have in the South Fulton region. Also, coming up in those discussions, we are really learning that our community residents are really interested in addressing those issues. But for the most part, they don't have the skills, the tools, or the strategies to get started on how to develop those messages, those advocacy pieces and things that they need to start raising the issues. So think for a moment, if you were facing some of the things that Dr. Chris has just described, what would you do? Well, let me just share a few things about some of the issues that the South Fulton People-Centered Community Economic Development Initiative are working on now. Most recently, a group of folks that are really looking at housing affordability and looking at the drivers and maybe hopefully solutions to some of those issues that's a real threat to residents in the South Fulton region. And most of you probably understand that housing affordability is not just a South Fulton issue, but it is a national and a worldwide issue. We really don't have enough units available where people who work 50 to 60 hours a week can afford and really live in a community where they can feel safe, in a community, as Dr. Chris has described, that has sidewalks so that people can create an opportunity for themselves to be mobile and more active by just walking. But if you don't have a sidewalk, then you can't even do that. And we know that in terms of our parks and recreational facilities, many of those are not connected to the communities. Many of them means that you have to have transportation and available transportation that can get you to maybe a rec center or to a park where you can participate in some type of physical activity. All of those kinds of needs should be available and accessible to community. All of those are important to the total well-being and the quality of life for individuals across the age spectrum. And the other community action team that is also really developing a survey to get community input on behavior and mental health issues. And that particular community action team really wants to identify again the drivers, solutions, identify the resources that we have in the community, and then understand what may be the cause of individuals and families not tapping into the resources that are available in the community. Well, actually, we are developing citizen resident researchers because they are the experts. We feel that residents that live in underserved communities are experts. We have organizations and schools that generally come into our community and do research, but we are reversing that. We are actually developing our residents and individuals that live in the community. They are doing the research. They're learning how to do data collection. They're learning how to do data analysis. They will be using this information so that they will have a voice. They will have a voice that represents them, their families, and the broader community. They will know how to hold their elected officials accountable to what's needed in the community and not having these programs or any other services that are usually come into the community but really don't really seek out the community buy-in. Is that something that they need, or is that something that they're just trying to sell the community? We are actually developing community residents so that they will be able to have their input as it relates to resources, the kinds of programs that individuals need in their own communities. So, again, we're looking at sustainability, we're looking at how do we make it more accessible, how do we make services and programs that are convenient for people that live in communities. Chris, is there something else that I missed that maybe I should speak a bit more about? Or
I think that was great. Hopefully we set up a nice framework for us to now have a discussion because we felt that either both Mary and I could, talk forever on this. We thought that it would be even better if we, particularly since this is a community driven discussion, that we hear from the community and then we tackle the questions that come across. Um, and I'll, return it to our facilitator to see if there are questions readily available. If not, I can take one of the questions that was provided to us and go from there.
Absolutely. Thank you. And thank you, Dr. Chris, and thank you, Ms. Wilson, for those words. As Dr. Chris mentioned, please feel free to submit your questions via the chat box, but we also have questions from registration. So Dr. Chris, you can take it away, or I can begin with the questions, whichever you prefer.
Since I'll start with one of the questions because it's a very good question. And it's a timely question. And the question was, how do we rebuild and improve post-COVID? And I think that question truly encompasses what we're here to discuss today, because if we first start off with the reality that our communities were have been most impacted by COVID, it's going to be a question that we will have to tackle long after they get this pandemic under control. And it goes back to, what does a healthy community look like? And that was why we were at risk to begin with. Too many of our communities, the residents were employed in those jobs that are considered frontline jobs. It turns out we are truly the essential workers of America. We're the ones working in the grocery stores. We're the ones working in the warehouses. We're integral to the transportation system, from public transportation to truck driving to delivery services, even, mail delivery. And because we are the essential workers, our community members are the essential workers, we were already inordinately exposed to the various communities when it came to the pandemic. But the other underlying issue is around that health. It has turned out that, you know, COVID-19 had a particularly significant impact on those with chronic illnesses. And it's those chronic illnesses that are already disparate in our communities: diabetes, cardiovascular disease, asthma. And so, what needs to happen going forward uh, is going to be threefold, because they even left out what is meant from an education standpoint, what's happening with our kids and how our kids managing this altered education system. So it's going to have a couple of things are going to happen. First, we're going to have to look at where we are from a health standpoint. What are we doing to regain or rebuild our health, particularly around those chronic illnesses, making sure we have our asthma under control, making sure we have our diabetes in control, making sure we have our hypertension under control. Um, what can we do to maximize our health and maximize our health beyond the healthcare system? Um, and so that's first. And I have to come back to what that means, maximizing our health beyond the healthcare system. The other thing is, how are we going to rebuild our work base? Because that's going to be key. Many people have lost their jobs and are losing their jobs. And there's a major concern that some of those jobs will not be coming back. And so what are we going to have to do as a community to regain employment and ability to earn a livable wage? And a few years ago, we were thinking that a livable wage would be $15 an hour. I realized that it's going to have to be more than that. Even at $20 an hour, that leaves an average income around $40,000. I do a study with my interns to find out what it would take for a person to afford a two-bedroom apartment in a mid-size car like a Corolla or a Sentra, in just the basic aspects of life. And that's really around $50,000 to $60,000 a year, if they have loans to pay back and a couple other things. And yet the median income in South Fulton is about $40,000. And so you can see why so many in our community have financial difficulty. And so how do we start teaching our community about better financial health? How do we ensure that they have employment opportunities going forward? Because that's going to be critical to moving past the pandemic. And then, like I said, the third thing is, what are we doing around the education of our kids? And also, what are we doing around the education of our young adults who may be facing employment challenges? How are we preparing them for a life going forward? How are we preparing them for a post-pandemic world where the traditional jobs may no longer be available, where jobs may now be more tech-based, more work from home based, require new skills? Are we preparing our young people while they're at home in front of a computer for a life where this is going to be the norm? And what does that mean? We can do all those things, but we do have to, as a community, become engaged. First, find out what's happening at the policy level, not just at the national policy level, with our presidents, vice presidents, but what is our school board is doing? What are our city council and county commissioners are doing? Um, just to be in preparation for this talk, I went back and looked to see how many people voted for the mayor of South Fulton. The mayor of South Fulton was chosen on 5,000 votes. In a city of 100,000 people, only about 10,000 or so voted for mayor. And the difference in the election was a few hundred votes. And so we keep hearing, what can we do? We can do things at the local level to start this conversation and make sure that the city we reside in is passing policies that are going to make sure that we're ready for post-COVID-19, that our school system, that the school board members we elect are ready for post-COVID-19, that other officials that we elect at the local level are ready for a post-COVID-19 world. And that post-COVID-19 world means making sure people have stable jobs, making sure that our young people have the education that's available to them, and finally making sure that even if the healthcare resources are not going to be available, that our environment is healthy for them, that we have access to healthy food, clean water, breathable air, because those have a greater impact on things like asthma, diabetes, hypertension than even my healthcare provider colleagues can do. And then I'll turn it over to Mary.
Thank you, Dr. Chris. And one of the things that I just want to lift up is that I was on a Zoom call earlier today with the Morehouse School of Medicine, high school, young adult, community health worker program. The reason why we were on that Zoom call is because we wanted to hear about the projects that those cohorts are working on this year. And again, because we are currently doing a community assessment around behavioral mental health. So one of the things that was really gratifying for me was to be able to talk to those young people. Again, if we're going to do things differently, we have to engage each other. And it has to happen across the age spectrum, not just adults meeting without the youth and our high school and young adults, but we all have to be at the table. We need their input. We need to hear their voices because they have issues that pertain to them in particular. Without having them actively engaged in any discussion about any of the things that Dr. Chris just talked about, we are just spinning our wheels because we don't have everyone that we need at the table. And yes, it's important. So we are actively looking forward to having those young people join us at the Behavior Mental Health Community Action Team and some of the other action teams as they come online. And as Dr. Chris was talking about workforce, economic development, yes, all of that is going to have to be different. One thing that COVID has created is an opportunity for us to reset everything that is not working for us. This is the time. This is the time that people can come together. This is the time that people will have to come together. If we are to move forward, if we are to have better quality of life, if we're going to have better health, then we're going to have to demand that. And we cannot do that by being isolated and working in silos. So just get ready. If you hear this conversation today, please let us know in the chat box if you're interested in participating in any of the activities that we are currently working on. We are focusing on 4 specific zip codes: 30315, 30354. That's along the East Cleveland Avenue corridor of Atlanta. We're working in zip code 30337, which is College Park, and 30344. But because we are engaging with some of the young high school community health workers and young adults that are part of that particular program, they can come from Fulton and Clayton County. So again, this is the time. If you want to see things different in your community, and if you expect for change to happen, it has to happen with you.
Thank you. Well, Dr. Chris and Miss Mary, you have the question. So I will let you determine which which direction you would like to go next.
Um, let's do how to fight health inequities. That is an all-encompassing question, uh, because one, it addresses the entire life cycle of the members of the community. From how do we ensure that those who desire children can not only have healthy infants, but they survive the childbirth experience to enjoy that healthy infant. And when we talk about healthy infants and a childbirth experience, we're talking about from the time of conception until that child reaches 1 year of age. One of the things that we must understand when it comes to maternal child health is not that 9 month period of pregnancy that we're looking at, that we need to start looking at childbirth as the moment that a mother wants to be pregnant. A mother to be wants to be pregnant, and that includes a healthy father as well. So maternal child health not only includes a healthy mother, but the father must be healthy as well. That's one of the things that is science showing needs greater attention. That both partners need to be healthy in producing a healthy infant that makes it to 1 year of life in a good state. That beyond that 1 year life, that toddlers are able to read, um, have developed a 30,000 word vocabulary by the time they're 2 to 3 years of age, and are reading by third grade. So looking at what is that child experiences from infancy to adolescence, because we're starting to learn that that is a very critical period of a child's life, not just obviously around, eating healthy, maintaining a good weight, having normal growth, um, getting all their vaccinations, but we're starting to understand that that child's lived experiences. Are they in a healthy household? Are they being exposed to environment? Do they live in a healthy community? Um, because those experiences have found to have been lead to chronic diseases later on in life. We call those experiences adverse childhood events. And if a child has so many adverse events in their lifespan, we now see issues of depression, of addiction, of cancer, of chronic diseases in adulthood. So we need to make sure that our youth, um, have a good period there. And then when we look at our teens and young adults, how do we ensure the healthy development of our teen and young adults? Even though they're at near peak physically, where are they at mentally? Where are they at emotionally? Even where they're at financially? How do we help them understand, you know, how to be, whole, what wellness actually means to them, and also how they're going to sustain themselves into adulthood. For our adults, what are we doing to make sure that one, those adults can sustain themselves, but also sustain a family? What does that mean? Can they afford the house they live in? Which means, are they spending more than 25 to 30% of their income on house utilities and so forth? Uh, are they able to save for retirement? Are they able to care for their kids? Are they able to provide their kids a nutritious meal, safe shelter, uh, you know, spiritual growth, a healthy mental environment? And also, are those adults able to prepare for retirement? And when they become seniors, do those seniors live in safe housing? Do they have adequate health care? If they perchance have health illnesses, they can receive the adequate care for those health illnesses. And can they transition to the spiritual plane, knowing that they've had a full rewarding life throughout their lifespan? And so when we start looking at health inequities, first, do we have the resources in place for everyone? Like I said, do they have adequate housing? Are we making sure that the communities in South Fulton or the city of Atlanta have the same level of care, of resources? Um, do the community have green space? Do they have safe streets? Do they have lighting? as our northern suburb communities have. Um, when someone wants to see a doctor, can they see a doctor? Can they afford that doctor? Will they have access to the medications they need at the pharmacy? If by chance they need to go to the hospital, they have a hospital they can go to and they don't have to travel across town to get to the hospital. And then when they do receive the care, they receive the care that's reflective of their belief system, their cultures, their language, and the resources that they're willing to use when they go back home. Um, and then finally, that through all this, that they have a workforce and an educational system that supports them all through all this. That's when we say health equity, those are all the things we're talking about with health equity. And we need to make sure that both as individuals, we understand that as communities, we understand that, and that we express this to all our policymakers, um, that this is what we want within our healthcare system and what equity means.
And just to add to that, Dr. Chris, I would just like to say that some of the professional development that we hope to impart to our residents are really around policy, helping them to understand that many times the reason why we don't have things in our community is because of a policy or the lack of a policy. So, some of the training opportunities that we will be presenting are courses like Everyday Democracy, that's going to give them an opportunity to understand what and how all of that is connected to the quality of life. And the things that you talked about across the spectrum of aging, if we reimagine what our communities should look like, then we have to talk about clean air. We have to talk about clean water. We have to talk about transportation. Many of the things that you talked about are not available in the communities where we live. There are no safe places sometimes in communities where people live. All of those indicators are necessary for you to have a quality of life, for you to grow, for you to develop, especially when we start to talk about young people, children, adolescents. How do you grow in an environment where there's trauma every day? And that is a lot of things that are going on. One of the major causes of depression and anxiety are the trauma that families do really experience. I served on the Fulton County grand jury last year, this time, for 2 months. And most of the cases that they were bringing before us were domestic violence cases, violence among families, violence among teens, violence among people that they knew. So we understand that a lot of the stressors, a lot of the things that are happening in our community would not be happening if people had access and opportunity to the kinds of things that will help them and support individuals and families to have a quality of life, things where they have access to jobs, quality education, so that young people will have a better opportunity and chances of achieving a successful career or put them on a pathway to a career that's going to support the kind of system, to support the kind of family lifestyles that most people want for their families. So, all of these are indicators that Dr. Chris is talking about. All of that needs the support of an entire community. We know from research that families do better when they live in communities that support them.
Thank you both, Dr. Chris and Ms. Mary, for a very comprehensive answer to the health equity question. We have time for one more question, and then I will ask you both for your closing thoughts and your charge for us moving forward as family members. So you actually, Dr. Chris, have been doing an excellent job of selecting the questions. So if you don't mind selecting the last question that you, Ms. Wilson, will be answering.
And the last question I'm going to use is pretty much can almost be my closing statement, or I'll let Mary have the closing statement because we are so much aligned. What do we do to take advantage of healthy resources in neighborhoods? We can have healthy communities, but residents are not utilizing those healthy resources available to them. And so, somewhat why? That is a very good question, and is one that we have to be very mindful of. And the reason why I have to be very mindful of is um, in this day and age, we talk about privilege, and we often talk about white privilege. But one of the things when I teach a course on privilege is helping everyone see everyone has some degree of privilege, and in that, we always have to check ourselves in the question of what do people know, what do people don't know, and what do people don't know that they don't know. And I'll give you a little story on how this works. Like I said, one of the main things, particularly as healthcare providers, we're always pushing people to eat healthy, eat healthy, eat healthy, eat more fruits and vegetables, eat more fruits and vegetables. And I remember a colleague of mine working with a local grocery in Atlanta, in Southwest Atlanta, started putting more healthy produce within the store. It was a neighborhood store, and typically it was always selling mostly packaged foods, processed foods, and very poor quality produce, if any produce at all. And so they made a concerted effort to sell more healthy produce. And the manager of the store noticed that people still were not buying the produce. And instead of taking the making the assumption that, oh, they just don't want it, they just want the junk food, they're not trying to eat healthy, um, he took it upon himself to see what do they know and what do they don't know, and what did he as a manager did not know, he didn't know. And it turns out that for many of the community that was not used to seeing produce, your asparagus, your cabbage, your broccoli, your Brussels sprouts, because they hadn't seen this. One, they were unfamiliar with it, and more importantly, even if they bought it, they didn't know what to do with it. And so the manager realized that first you have to actually explain to the community what these resources were. In this case, this is what the produce is, and then taught them, did cooking demos in the store so they learned how to prepare it. And then they saw an increase in the community buying said produce. And that's often the case when we're looking at people and wondering why won't they do better for themselves. Too often it's a case of one, they may not be familiar. When you've deprived people for so long, um, what we think is normal and common becomes uncommon. But just as important, just because we introduced it to them, if they're not familiar with it, or if they haven't had a chance to utilize it, or if they had experiences that have led to distrust, what needs to be done is to rebuild that trust, find education, provide education around the resource, and then, interestingly enough, accept what they can do with it at that point in time. It's sort of like exercise. Um, you may want to run a marathon, but if you've never run before, let's get you walking 100 yards. And once we get you walking 100 yards, then maybe we can get you walking 4 or 5 miles. And then once we get you walking 4 or 5 miles, then we can get you jogging. And then once we get you jogging, maybe you do a 10K. Then after a 10K, a half marathon. And in time, yes, you are running a marathon, but we can't say take you off the couch and say go run a marathon, and then when you are unsuccessful, say you just didn't want to run a marathon. That's too often the case. What we do to the community members when we say why won't they use these resources, it's not that they don't want to use the resources, they are unfamiliar, they've had bad experiences, or they're at a space where we need to step back and provide them more achievable steps benchmarks or goals and build up to where we want them to be. Mary?
Yes, and just to add another comment around why aren't people using the resources that are available. Those resources may be there, but perhaps, as Dr. Chris has said, sometimes it's because they are not familiar with those fresh fruits or vegetables. Sometimes they haven't even had the opportunity to taste them. And so they are unfamiliar. But one of the other things that I wanted to say, another thing that COVID-19 has really brought to our attention is because we have felt that people who walk around with cell phones would obviously be able to use them to do a Zoom meeting or to get online. But that is not the case because many times people who have cell phones don't necessarily have the same carriers. Some carriers who might be less expensive, they may not provide the type of coverage that people need to access Zoom calls or Zoom meetings. So we need to make sure that we are really meeting the needs of the populations that we're serving across all levels, not just making the accusations that, well, there are resources, but people are not taking advantage of them. Generally, that is not the case. There is a reason for them not doing it. And it really is up to us to find out why they're not using those resources. So, in terms of the closing statement, I just want to make sure that everyone who has tuned in to our conversation this afternoon have really got something that they can walk away with, that they can do by Tuesday of next week as it relates to resetting whatever it is that you might have been putting off or may have had some intentions around, because we really need our community to all become connected. This is a time, this is a season where we need everyone to who have registered to vote to go out and vote. Early voting starts on Monday in Fulton County. So definitely, if you can go to the polls, please start going, making sure that you and whomever is eligible in your households to go out and vote. And after you vote, then hold your elected officials accountable to the things that you need and want to see in your community. Again, we want to do better, but it has to start with us. Thank you so much for joining us this afternoon.
Thank you.
Dr. Chris and Ms. Wilson, thank you both so much for an extremely informative and engaging presentation. And also to today's attendees, to the family members that joined us for today's session, thank you for joining us today. Next week, Saturday, will be our final session. So we definitely want you to come back, and we want you to invite everyone that you know for the closing of the closing session and closing ceremony for the FAM Strong series. And on behalf of the Morehouse School of Medicine Prevention Research Center, we thank you for attending today's FAM Strong event, and we again invite you to connect with the Morehouse School of Medicine Prevention Research Center via your favorite social media platform using the hashtag FAMStrong20. And we wish each of you a wonderful evening.